Everyone, and welcome back to Magazika. Today we have the pleasure of speaking with Dr. Radin Kamvar. Dr. Kamvar is a medical doctor with a deep interest in how our bodies and mind work, especially when it comes to our hearts and our brain. He's also an international medical graduate, in short, we called IMGs, showcasing his dedication to medicine on a global scale. Dr. Kamvar is passionate about making a real difference in people's lives through medicine. We are honored to have him share his journey, insights, and expertise with us today. Insights that can help us live a better, a little healthier, a little smarter life. So let's dive in. Dr. Kamvar, welcome.
Thank you very much for inviting me and beautiful introduction. I just want to say hello to the viewers and also all those readers. And thank you for having me here.
Oh, it's a pleasure to have you here. So, becoming a doctor is a long and challenging journey, as we all understand. What initially sparked your interest in medicine, and was there any specific moment or experience that solidified this path for you? Your journey so far, please.
Okay. That's a good question, actually. So I've had this strong interest in medicine and healthcare since childhood. And I remember a specific moment that my grandfather was diagnosed with a heart condition that's called aortic stenosis, and he ended up in the hospital. And when we went to the hospital and I was seeing the medical team, the physicians, like how they are communicating and trying to find a better solution for the patients and find a good management plan. I was so interested, like how beautiful it is and how important the role of healthcare system is in the society, especially physicians, like how important they are in our society. And from that moment, I realized that I need to pursue medical, get a medical degree and practice as a physician in the future.
So you are an international medical graduate. So that speaks volumes about your determination and adaptability. Could you share a little about that journey that has been like, and perhaps some key lessons and milestones you have learned navigating different healthcare systems and educational approaches?
Yes, of course. Thank you for your kind words. So it's been definitely been challenging since starting the medical school. So I started my medical journey in Hungary back in 2016, and from there I had a lot of challenges with the new environment, and I needed to learn the new language. As you know, the Hungarian language is one of the toughest language in the world. So in order to speak to patients and work in the healthcare system, I needed to learn Hungarian language and adapt to the environment, as it was different from my home country, Iran, which is a lot different than Hungary. And there I learned a lot of things from my mentors and my professors, and great specialist in different fields. And if I want to say a name, I want to say Dr. Professor Miklos Jaspereni. He's one of the great researchers in field of neurodegenerative disorders, and he's a great mentor. And he helped me and guided me in this journey a lot. And I really appreciate that he helped me through this journey. And in Hungary, we had a lot of challenges with the exams, with the language, and in the clinical system, when we were talking to the patients, it was challenging to communicate. So we needed to work harder than other medical students, which were Hungarian. But anyways, after graduating from Hungary back in 2023, I moved to Canada, Ontario, and I started to prepare for my licensing exam, which all IMG knows, um, MCCQE1 and the NACOSKI. And so I was doing, studying, and beside that, I was working alongside great physicians in Canada, cardiologists, and neurologists, and thankfully I passed both exams and finished both licensing exams. And right now I'm in the residency process to get my residency application done. And I think it's a long journey. Medical field is a vast field. If you enter it, you have to know that you need to work hard. You have to be optimistic and don't lose hope. I mean, when you are entering a different country with different cultures and different people, you have to adapt. So adaptability is very important. So based on my experience, I lived in Iran, Hungary, in Europe, and here in Canada. I saw differences. Of course, some things are similar between these countries, but many things are different. If I want to tell you an example, like in my home country, Iran, our healthcare system is doctor-centered. And so the doctor is the God, the doctor is the leader, and anything doctor says, the patient must obey and do it. But here in Canada, that's the positive thing of Canada, that it's patient-centered. So we give the options to the patients and they decide what they want to do. They decide which option they choose. So that's really important. Another thing that I learned when I came to Canada, I see many different people with different backgrounds, different cultures, and even religions. And as a physician, as someone who's working in the healthcare, we have to respect every patient equally. We shouldn't judge them by their religion, judge them by the color of their skin, or their culture. So we have to respect their opinion, respect what they believe, and we don't judge them. So what we should do here, in Canada specifically, patients are important for the physicians, and patients' needs are important for them. So here, patients are first. So we respect them, we do not judge, and we treat them. So we give them the options and they decide which option they choose. And so as a physician who studied back in Hungary, I learned that I have to be adaptable. I should adapt to the environment that I'm living there. So in medicine, I believe adaptability is very important and is a key in practicing medicine, especially in healthcare.
Fantastic, fantastic.
Thank you.
So let's move on to the your field of interest and something. So your interest, your research interest, and everything is in the cardiovascular diseases and neurocognitive disorders. So let's stick with the first one. So the cardiovascular diseases. So what are these? What is the specific field of whenever we hear the word or phrase cardiovascular diseases, and why are they so critical for everyone to understand? Please.
Yes. So you say cardiovascular diseases. So anything related to the heart, anything like hypertension, as other people know as high blood pressure, which lead to many different heart issues. It can damage our kidneys, liver, eyes, and so more. So one of it is hypertension. There are multiple things: valve disorders, heart failure, and anything which is related to the heart, call it cardiovascular disorder. And it's very crucial to pay more attention to our heart health. And how can we do that? Like in case of hypertension, as you know, I mean, I think most of the people know that if you reduce salt, that's important for the blood pressure. Or our lifestyle, like how we live. If we have sedentary lifestyle, if we just sit on the chair and we don't move, we don't go walk, bike, or run, that's a negative effect on our health, on our cardiovascular system, on our body, and it can lead to many bad outcomes for the patient, for us. So what should we do? We have to control them, okay? But a lot of people do not realize that how important these simple changes could change their life. For example, let's say salt. If someone is taking a lot of salt daily, they are more prone to developing high blood pressure. If their gene, if the genetic, if they have in their family in someone with high blood pressure, they are more prone to be hypertensive patient in the future. So if they have someone in the family with this condition, they have to be more careful with their lifestyle. They need to be more active. They need to cut down sugar, processed food, salts. They are really bad. I don't say don't go to fast food, don't go to McDonald's, but we have to make sure that it's not in excess. That's very important in our health, in heart health. And also, four things are important in high blood pressure, hypertension. I want to ask you if you can help me. What
Please.
else can lead to hypertension? If you can think of anything.
Stress
Okay. Yes.
and imbalanced diet.
Yes, exactly. Imbalanced diet and sleep. So
Sleep. Okay.
sleep, yeah. So if someone is going to sleep at 2 a.m. and then wake up at 7, 8, this bad sleep cycle can lead to developing hypertension. So we have 4S in hypertension. We have reduce salt, so salt, stop smoking, and sleep, good quality sleep. So 4, why I said 4, because stop smoking, that's 2S. So that's why I said 4. So smoking is also important. People who smoke are more prone to developing hypertension and cardiovascular diseases and cancer. So people who do smoke, they are increasing the risk of cancer. So we have to take care of our body, make sure we are not accessing junk foods, fast food, processed foods. Make sure we have good sleep. We have to make sure we are not stressed out. I know that people have a lot of stress nowadays in this economy, and these things are happening in the country. But we have to make sure that even with meditations or yoga or those things which could help us to lower our stress level. And workout. So walking at least 45 minutes is crucial for heart health. At least 45 minutes per day is important for heart health, and it can reduce the risk of cardiovascular diseases and cancer too.
Fantastic suggestions. Basically, that was also my next question, that what are the common things that common people, before getting into even doctor, from the very early age, they can do so that their chances or probabilities of cardiovascular diseases reduces. So you answered that very nicely and everything. So let's now go to your second interest of, that's what I got from your profile, that on the other side of our research is neurocognitive disorders. That can sound sometimes for the non-medical people like us kind of intimidating. It's a very big word. In your view, what's the common misconceptions about brain health that you wish more people would understand very clearly?
Okay, so it's again, a very good question you asked me, there are many misconceptions that people think about neurocognitive disorder. So some people think that neurocognitive disorder is just Alzheimer's disease, but that's not true. Neurocognitive disorder is an umbrella which Alzheimer's disease is under it's one of the subtypes of neurocognitive disorder. We have many diseases that lead to dementia and is under this umbrella,
Mm.
like Lewy body dementia, vascular dementia, and Parkinson disease, which can lead to dementia and cognitive decline, Huntington disease, and some more disorders that have this cognitive decline. So what we mean by neurocognitive disorder is that when a person's cognition is going down, so cognitive decline, when the person, for example, in case of Alzheimer's disease, so it's a progressive neurodegenerative disorder that the patient is forgetting things, forgetting family members, forgetting how to do daily tasks that they could have done in the past, or they even can't go to the bathroom, they cannot wash the dishes, they cannot do these simple tasks alone.
Mm.
And so forgetfulness and cognitive decline is the main feature of neurocognitive disorder. But neurocognitive disorder does not mean Alzheimer. Alzheimer is one type of neurocognitive disorder.
Oh, okay.
That's one misconception about neurocognitive disorder. Can you see my video? Because I think
Meanwhile, it's just frozen a bit. Now it's okay. Now it's okay.
now it's good. Okay.
Now it's good. Now it's good. Please.
Okay. And people think that Alzheimer's disease or dementia is just with aging. Like as people age, like they let's say they are 70, 80, okay, their cognition goes down and then we call it Alzheimer's disease, but that's not true. So, in time being occasional forgetfulness, like sometimes we forget someone's name, that's okay. But when these lead to forgetting family members, or they are something like when they cannot do simple activities in their life, that could be Alzheimer's disease that need to be checked.
Mm.
So that is not normal process of aging, and that could be a sign of Alzheimer's disease that need to be checked. So in Alzheimer's disease, unfortunately there is no cure for the condition, but there are some medications to slow down the progress and help the patients with the symptoms, like psychiatric symptoms they sometimes develop, like depression, anxiety disorder, and so with different medications we can manage those psychiatric symptoms too. But unfortunately, researchers couldn't find any definitive cure for this condition. But I'm hopeful that future researchers could develop something for it, because it's so common nowadays.
And regarding the future, the world of medicine is changing constantly, changing, evolving, and with new technologies and discoveries. So, what are what are you most excited about the future of healthcare? Like, what aspect of it, or in your field, what are the sides that you are most excited about the future evolving and the direction that it is evolving with the advancements and all?
Okay, so I think AI is growing these days, and especially in the healthcare system. And I'm really excited to see, like in the future, like in 10 years' time, what's going to happen to the AI. Is it going to be advanced, that much advanced, that take over the role of some physicians, like radiologists in the field? But I hope not. I hope they are not getting the position of, healthcare professionals. But as you know, I can give you an example, like in cardiology, there are some AI-powered imaging, and there are some wearable devices that allow for earlier detection of heart diseases. And this could lead to prevention, or even prevention from progressing the condition. If a person is having the disease and having the symptoms, those devices could prevent. So that's really important, and one of the advantages of AI. And also, I think they are important in the diagnostic system. So they can help physicians in diagnosing different conditions. And in the future, maybe it will come to help different physicians, different specialties, like pathologists or radiologists, that the AI could detect what's wrong with that patient. Like, it could detect what are these cells, and that pathology could make sure that the AI is right. So we have two, let's say they have two physicians at the same time, the AI and the actual physician. That is important. Also in the oncology, in the cancer, maybe they can help us to detect different kind of cancers, um, or biomarkers, and improve the patient outcomes, cancer patients. And maybe we can detect tumors in earlier stages, like it doesn't go to the end stage. Who knows? And I'm really hopeful and optimistic that that day is not far, and we can see that AI is helping us in the healthcare system more and more.
Yeah, yeah. And with the AI, there is another aspect that, again, for the common people and for the people like us who are kind of non-medical in that sense. We do not have any medical background, but in this information revolution age, there are lots of information available online. What would be your top piece of advice on how to find trustworthy sources and make informed decision about our health?
So as you know, many people, even us, like my family, many people are using Dr. Google. And when they're experiencing symptoms, let's say they are having an abdominal pain, they search it, abdominal pain causes. The Google brings some diseases, and oh my God, it might be cancer. Like, and you know, it's a good resource. Like, we increase our knowledge with Google, like read articles and different things on internet about different conditions, the medications, how we diagnose a condition. But if we just rely on, uh, let's say, Google or now ChatGPT or these kind of things, we just get stressed for no reason. So this can lead to excessive and unnecessary anxiety. So that person is checking like causes of abdominal pains. Oh my God, it might be cancer. Then
Oh God.
it might be like a gastric ulcer. That's it, nothing else. So it's not good to rely on the Google, the internet only. It's good to get knowledge from it. But if someone is getting symptoms or they are worried about their health, they need to go to their a family doctor and let them know what's going on. And they are experienced physicians and they are experienced in this field. So they know why they do have these symptoms, and they can have further management, I mean, the diagnostic interventions, so different imaging, and then they can say, okay, you have this condition. So I think people shouldn't rely on Google.
Learn from real human intelligence, not artificial intelligence.
Exactly. Yes.
Okay. Um, we are almost at the end of the conversation. So, looking back at your journey so far that you have made, fantastic fiats and achievements, what's been the most rewarding aspect of pursuing a career in medicine, and what keeps you motivated during the challenging times?
So what I believe the most rewarding part of medicine is like making a real difference in people's lives. How? How do we do that? Like with helping them understand their condition and like let them know what condition they have and they understand what's the reason behind those symptoms or anything they have. And also giving them support is also very important in the difficult times. And what keeps me motivated is knowing that one day I will make a meaningful impact on many patients' lives in the future, hopefully, and I will help them and heal them and support them in many aspects. And yeah, so I think that's why I keep moving and studying, going forward for those days, for good days.
Mhm. Finally, we're at the very end of the discussion. Finally, Dr. Kamvar, for someone inspired by your story and potentially considering a path in healthcare themselves as an IMG or in any aspect or in any capacity coming into Canada, what's your pieces of advice will be for them to support their journey?
Again, good question you asked me. As you know, many IMGs are here in Canada, and even maybe they're coming now to this country to pursue medicine. I mean, get their licenses and practice medicine here. And as you know, it's a difficult journey in this country, specifically with so many talented doctors who are here, and there are so many doctors, and it's so competitive to get into the healthcare system. So people who are studying for the licensing exams, I would tell them that to don't stop, just study hard, don't lose hope, and study hard and do your exams, and hopefully you get past all these licensing exams. And if things don't go as planned, don't lose hope, don't get disappointed. Success is not in one day. So they say it's like you need 100 days of difficulty to reach your goal. And it takes time, persistence, and resilience. And if you are not where you want to be yet, keep fighting, keep working hard, and stay passionate about your goal, medicine, and believe in yourself. And if you have challenges and setbacks, don't be disappointed. They are a part of this journey, but they do not define your future. Uh, they don't define your future, but you have to fight for it. Never give up, trust, and you will reach the position you worked so hard for it. Believe in that.
Thank you, Dr. Conver. Thank you for sharing all those beautiful insights with our readers and viewers. Thank you very much.
Thank you for having me again, and hope you have a lovely day ahead.
Thank you. Thank you. Thank you.